Thank you. So today I'd like to discuss about the medical imaging techniques and some diagnostic techniques related to this. So actually, diagnostic techniques involve measurements of uh, or measurement. It is used to help in detection of some malfunction of the system of our body, and such instrumentation system may also called as the troubleshooting equipment. So the diagnostic equipments and their underlying principles related to uh, ultrasonic, related to X-ray, related to radioisotope or CT scan or ECT, that is emission computerized tomography, or MRI. So these are related to somehow medical imaging techniques. So now these techniques of diagnostic does not involve getting inside the body physically or uh, invading it. Therefore, these are known as non-invasive uh, diagnostic techniques. So this okay. So these non-invasive techniques are very sophisticated, and this technique are not traumatic for the uh, patient and do not have any uh, determinantal side effects on the patient. Okay, so it is a very sophisticated, which very sophisticated method which offer accurate results without invasion of the body. So usual method of blood pressure measurements is non-invasive, which has been around 40 years we have seen it. So next, move to the next slide. So principles of ultrasonic measurement. So ultrasound, that is the sonic energy at frequencies above the audible range, that is greater than the 20 kilohertz, as all of you know that. So ultrasound basically exists as a sequence of alternate compressions and refraction of a suitable medium, that is air, um, water, or bone, or tissue, etc. So it is propagated through that through the medium at some velocity, and it is also frequency and medium density dependent. So in normal applications, ultrasound is actually focused into a beam which obeys laws of reflection and refraction. Okay, as you can see it in this picture. So the reflected so this reflected energy is dependent on the difference of uh, densities between the two media and the angle at which the transmitted beam hits the medium. So higher the difference in media, the higher will be the reflection. And if the angle of incidence between the beam and the interface is uh, closer to 90 degree, the reflected portions would be more. And if the media difference is high, that is tissue and wait a minute. So if the media difference is high, that is tissue and bone, or tissue and gas, most of the energy will be reflected, and almost no energy will continue through the second medium. And we can uh, say that the ultrasound propagation path must not include bone or any gaseous medium or air. So an airless contact is produced through using an aqueous gel or a water bag between the transducer part and the skin for application of ultrasound. Okay. Okay. Rajanna, are you there? Rajanna, can you hear me? Hello. Uh, Devaraya?
Yes, sir.
Okay, I would like to make a host so that anyone who wants to join, you can join them. Okay.
Okay.
Okay. So move on to the next slide. So ultrasonic characteristics of some selected materials have been listed here. So the velocity of sound propagation through a medium is dependent on density of the medium, its elastic properties, and the temperature also. So here the velocity of most body fluid is around 1550 meter per second. That is higher than water. The velocity of through bone, that is 3360 meter per second, whereas to the uh, fat is much lower, which is 1440 meter per second. Okay. So the depth of penetration at which the ultrasound energy is attenuated to half the applied amount is known as the half value layer of the material. Okay, so what is that? That is the half value of the medium is the indicator of absorption capacity of ultrasound energy, and that half value layer of individual material has been listed over there. So this is the ultrasound absorption by the different material like blood, muscle, fat, and bone. So an important characteristics of ultrasound frequency used in biomedical instrumentation is the Doppler effect. So if the frequency of the reflected ultrasonic energy, that is increased or decreased by a moving interface, the frequency shift is given as del f equals to mu by lambda, where these are the different parameters like reflected wave frequency shift, interface velocity, and the transmitted ultrasound wavelength. So the frequency increases if the interface moves towards the transducer and decreases when moves away. So if ultrasound is reflected from a moving object, the measured frequency shift is proportional to velocity. Okay, that is the Doppler effect. Now, ultrasound is transmitted in various forms. There are different modes are available like pulsed ultrasound mode, continuous Doppler mode, pulse Doppler mode, or range gated pulse Doppler mode. So I will discuss one by one. What is the pulse ultrasound mode? What is happened in this case? So it is transmitted in pulsed form at a frequency like 1 to 10 or 12 kilohertz. So pulse duration is about 1, here in this case that will be 1 microsecond. The returning echoes are displayed with respect to time, and echoes are proportional to the distance from the source to that interface. It is basically used in most of the imaging applications. Next is the continuous Doppler mode. So here the continuous ultrasound signal is transmitted, and a separate receiving transducer picks up the returning echoes. So the frequency shift due to moving interface, these are detected, and the average velocity of the targets is determined as a function of time, and it is basically used in uh, different blood flow measurement technique. Next is the pulsed Doppler mode, that is similar to pulsed ultrasound. Uh, in this case, also the short pulse of ultrasound are transmitted, and the returning echoes are received. The frequency shift that must be observed, and the velocity and distance of moving target, these are measured using this pulse Doppler. Next is the range gated pulse Doppler, where the gating circuit is used for measurement of velocity of targets at a specific distance from the transducer. The velocity of blood that can be measured as a function of time, and also as a function of the distance from the vessel wall. So these are the different modes which are available in case of ultrasound. Now ultrasonic imaging. So the imaging of internal organs or structures of our body is on the basis of ultrasound principles, which is also known as the non-invasive technique, as I have told you earlier. Now this gives the information regarding size, regarding the location, displacement or velocity of a given organ without any surgery or any harmful radiation. Now tumors can be easily identified using this technique, and this technique basically avoid the risky or uh, painful procedures. Okay. So imaging systems are comprised of the pulse ultrasound or pulse Doppler mode technique. The received information is first amplified and then displayed in one of the several display modes which are available as A scan display, M scan display, or B scan display. Okay, three modes are available. Now in A scan display, here, that is the picture where the transmitted pulses trigger the sweep, and uh, so it triggers the sweep of an oscilloscope. The transmitted pulses and echoes are displayed as vertical deflections on the trace. Okay, and basically the A mode, it significant, so simplest form of ultrasound imaging, which is uh, so which is based on the pulse echo principle, and A scan that can be used to measure the distances, and it gives you the one dimensional information. So it is basically based on the amplitude, so a for amplitude. Okay, so application of this type of A scan display, where in ophthalmology, that is eye length or any tumor can be uh, detected, or localization of brain midline, liver cirrhosis, or myocardial infection. And here the frequencies are used as 2 to 5 megahertz for abdominal, cardiac, and brain. And for ophthalmology, it will be 5 to 15 megahertz. Okay, so different ophthalmology. So it is used in ophthalmology to determine the relative distance between the different regions of the eye, and that can be used to detect the corneal detachment. Next is the M scan display. So as M denotes the moving object. Okay, so M denotes the moving. So, or or you can say it the motion also. Okay. um, Here the transmitted pulses trigger the oscilloscope sweep, but the received pulses are used to increase the brightness of the trace instead of controlling the vertical deflection, uh, in case of which was happened in a scan display. The actually the brightness, so it represents the movements of structures over time. Okay. And the brightness of the trace is set below visibility level so that the brightness becomes proportional to each echoes. And generally it is used to measure the cardiac chambers dimensions and assess the valvular structure and function. Sorry, it is not used in valvular structure. The B scan will be used for valvular structure and function determination and for cardiac chamber. So M scan display, basically it is used to measuring the chamber dimensions. Next is the B scan display, where it is a two-dimensional uh, image, and B stands for brightness. So B scans give two-dimensional information about the cross section of a stationary organ or body structure. And the brightness of the oscilloscope is controlled by returning echoes. And here the transducer that is moved with respect to the body and vertical deflection of the oscilloscope correspond to the movement of the transducer. Okay, as you can see in this picture. So it is basically used to assess the valvular structure and functions. Now, coming to the move on to the next slide. So ultrasonic diagnosis techniques, these are used in cardiology, these are used in abdominal imaging or brain studies, eye analysis, or obstetrics and gynecology. Now, the record may be named using echo or sono words such as echocardiogram. You have heard about that. That is echocardiogram, that is record of ultrasonic measurement of heart. The echoencephalogram, that is a record of ultrasonic measurement of the brain. And for eye analysis, it is called the ultrasonogram. Now, the ultrasonograph is used for imaging of the organ from several positions and help in visualization of all four chambers and all four values of the heart, and also the uh, arteries and the veins. The systems for ultrasonic applications are uh, inclusive of a generator for the electrical signal, a transducer will be there, necessary amplifier will be there, and several electronic processing circuits and the display devices. Now, the transducer, what is the use of this transducer? The transducer converts the electrical signals into the mechanical vibrations, which in turn give the acoustic waves. Now, this acoustic wave enters the body through the spin surface and is propagated in a predetermined beam pattern. Now, if the ultrasonic wave strikes an uh, acoustic interface, such as the boundary of an organ, some energy is reflected, and transducers uh, picks up that reflected energy and is amplified and processed and displayed to the uh, screen, and it is recorded. So the transducers are available to suit various frequencies up to say 5 megahertz, and in various sizes to suit that particular application. And one very largely accepted transducer is the microprobe needle transducers are used to process the ultrasonic diagnosis. Okay, so one is the scheme which is over there on the left hand side, and on the right hand side, that is the uh, diagram of a echocardiogram. Okay, so the echocardiogram here, it finds the major application in cardiovascular diagnosis, which basically utilizes the IM scan display mode. So here the movements of the valves and other parts of the heart, these are displayed as a function of time, usually in conjunction with the electrocardiogram. So this type of electrocardiogram is useful in interpreting the movements of the mitral valve with respect to time, and the mobility of the value is given as the displacement of the echo per unit time. Here, the transducer is placed such that the beam cross the chest wall into the right ventricle through the septum into the left ventricle and then through the left atrium. So the image of aorta and mitral valve are also obtained using this technique. So echocardiography that can be used to detect the fluids uh, presence surrounding the heart due to pericardium inflammation and escape of fluid. So it may be noted that transducer selection is dependent on the type of the investigation which is to be performed, as well as the physical size of the patient and the anatomic area which is involved, the type of tissue that is to be encountered, and the depth of the organs that is to be studied here. That is also to be considered. Another, so this is echocardiogram. So another is available like echoencephalography. So echoencephalography, that is the ultrasonic imaging using the scan mode of display for uh, determination of the location of the midline of the brain. Okay. So here the transducer is held against the side of the head to measure the distance to the midline of the brain. The midline echoes from both sides of the head are displayed on the oscilloscope simultaneously, and one side gives the upward deflection of the beam and the other side gives the downward deflection. So if these two deflections line up, then distance from the midline to each side of the head, these are equal. And if it is non-aligned, then the possibility of tumor or some disorder maybe exists. So move on to the next slide. So X-ray, after that, after ultrasonography, so we are coming to the X-ray and radio isotopic instrumentation system, where X-rays can penetrate opaque objects and provide an image of their inner structure. Okay, these imaging are used for medical diagnosis. So different therapeutic purposes it can be used, and this is the domain of the medical specialty known as the radiology. So X-ray equipments are a major part of this medical instrumentation. So X-ray, these are, what is X-ray? X-ray, these are the electromagnetic waves which have a much shorter wavelength than radio waves or visible light, and the wavelength that can be varied from between the 10 to the power minus 6 to 10 to the power minus 10 centimeter. That is a frequency range of between 10 to the power 10 and 10 to the power 14 megahertz. Now how it is generated, here is a diagram. So ionizing radiation generation. So when fast moving electrons are suddenly deaccelerated by impinging on a target, so X-rays are generated. Okay, so here X-ray tube is there, uh, which is a high vacuum diode with a heated cathode located opposite target anode. So the intensity of X-rays depends on the current through the tube. Now, the wavelength of this X-ray, it depends on the target material also and the velocity of the electrons which holding the target. So the X-ray equipment for diagnostic purposes uses target voltage in the range of assume 30 to 100 kilovolt, whereas the current is in the range of several hundred milliamperes. Okay. So X-ray film construction and instrumentation. So how it interacts with our body, how the film constructed, and the instrumentation system. It is just like one given block diagram, this type of pictorial representation of film construction. So once actually bones, metallic parts, air-filled cavities have different densities from the surrounding tissue. Therefore, X-ray machines are able to show up well the high density parts, that is bones, metallic parts, air-filled cavities, etc. So once X-rays penetrate a body part, internal part structure absorbs varying amount of radiation. So this radiation that leaves the body has varying intensity of images on this screen. Now the X-rays are visualized for imaging by techniques such as the fluoroscopy technique, the photographic emulsions technique, image intensifier techniques, etc. And so TV camera, different monitors, tape recorders, and X-ray machines, these are also available for diagnostic purpose. Okay, so special techniques such as grid techniques means the scattered X-rays when these are absorbed. So different contrast media and the angiography. So what is related to this? The blood vessels filled with contrast materials by injection. Okay, so cardiac catheterization also, and three-dimensional visualizations are available in the X-ray machines. So the X-ray naturally then is also able to diagnose other than bones or metallic parts. Okay, so here is the block diagram of X-ray machine. So the diagnostic X-ray machine has high milliampere large current for heating element and low exposure time. The therapeutic purpose X-ray machine has a low milliampere and high uh, uh, kilovolt potential difference between anode and cathode is there. Okay, so in here in this case, how the X-ray film is to be processed. So there is a technique like X-rays have quite shorter wavelengths than visible light. Now it reacts with photographic emulsion in a similar fashion as that of light. Now, once it is processed in developing solution, a film that has been exposed to X-rays showed an image of the X-ray intensity. Now, as the X-ray film is insensitive to X-rays, therefore sensitivity is improved by first producing a visible uh, image to which the film is exposed. Now, for achieving this, intensifying screens are used, which consist of a layer of fluorescent uh, type material that is to be bonded to the plastic base, and then the X-ray film is sandwiched between two screens and kept in a light tight cassette. Therefore, the film is exposed to X-rays as well as to the light from the fluorescence of the screen, and these are the intensifying screens. Now, the most commonly used material is used as the calcium tungsten, which emits a broad spectrum of light of low intensity in blue wavelength. Now, before coming to the actual exposure, the film materials must have been kept in the dark room during the past 12 hours. This is considered the best preparation. Now, the adaptation to a new temperature is quite fast and occurs within few minutes. It can take several hours for a film to get dimensionally stabilized after a change in relative humidity. Okay, then the storage of the hermetically sealed film package is usually done in a refrigerator. Now, this maintains the film characteristics even beyond the expiry date, which usually applies for the storage under room conditions at suppose 20 degrees centigrade. Now, if the package is opened, it can be put back into the refrigerator after sealed it again. Now, the developer, which is as per recommended uh, of the film manufacturer. So all the parameters during film development is kept constant, so that a negative with the same exposure will produce the same quality of negative at any time. So a bath thermometer is used to check the temperature of the developer, and the temperature may be 20 degree plus minus 2 degrees centigrade of the ordinary developer, which gives the best results if kept constant. So at room temperature between 18 degrees centigrade to 25 degrees centigrade, the working solution will it maintain its properties in an open tray for just 4 hours, and the stack solution kept in a uh, stoppered bottle will preserve the properties for 2 months if the bottle is half full, and up to 6 months if the bottle is full. Now, this shelf life figures that can be improved by keeping the solutions in the refrigerator and are reduced at high temperature. So a developing tray large enough to enable film handling with ease of selected sufficient developer that is put into the tray such that the film can be completely covered with it. So all the handling the film is won by touching only uh, the comes with suitable forceps. As no forceps is changed from one tray to another. So slides the exposed film sheet with emulsion it downs to the solution and turn it quickly and place it into the solution and start immediately to leave the tray rotationally and each side by some distance. Now this should occur in a rhythm of about 5 seconds for one full cycle and should continue for whole developing period. Okay, so after the film development, the film is gripped with the forceps on one edge and lifted above the developing tray for about some one some 3 to 4 seconds to enable the excess developer to drop. Soon after that, the film is immersed into the stop bath, keeping the emulsion side upward to avoid mechanical uh, damages of the on the softened emulsion part. So this stop bath stops the development action, and this stop bath is acid type as per the recommendation of the film manufacturer. So normally, what happened? The emulsion is uh, properly fixed after immersion into the uh, fixing solution for twice the time it takes for the uh, for clear appearance. And a normal light in the dark room is switched on after disappearance uh, of the some hazy emulsion. Okay, now the emulsion saturated with the chemicals of the fixing bath and some dissolved silver compounds still remain into this film. So it is washed by running water to such an extent in the washing tank take place around 5 minutes, and the duration of the washing should be around 30 minutes or as recommended by the film manufacturer. Now after washing, a dip in a wetting agent is important for the drying process, and drying should be takes place slowly at room temperature. Okay, then after drying it is ready to use. So that is the X-ray machine properties, including the film processing. So next is the radioisotope instrumentation. So radioisotope techniques are based on the counting the number of nuclear disintegrations that occur in a radioactive sample during a certain time interval. And here the nuclear radiation detectors used for medical applications utilize the light flashes caused by the radiation in a suitable medium. So here you can see from this diagram, uh, so here the scintillation detector is, these are used for gamma rays. So it has a crystal through which the radiation when passed gives an output pulse at the 40 multiplier tube. Now the amplitude of the radiation is proportional to the energy of the radiation, and this helps to reduce the background by means of a pulse height analyzer. Okay, the electronic circuit which passes only pulses within certain amplitude range, and adjustment in this circuit is to be made in such way that only the pulses from the radioisotope used that can pass through it. So in a radioisotope scanner, the detectors are also available, which is slowly moved over the area which is to be examined for different images. And this radiation therapy, that is in another area of X-ray application, the harnessing effect of X-ray that is utilized in what I have told you that radiation uh, therapy, that is the another area of the X-ray application. So the ionizing effect of X-ray that is utilized in the treatment of deep-seated tumor. In such cases, very hard X-rays are generated for seize the tumors, and soft X-rays are used for treatment of the skin. Now, digital radiographic diagnostic and therapeutic technique. So radiography that has a digital image which is stored in a computer. Now this facilitates the image processing for better displayed images, and it has digital storage with with a picture achieving and communication system or remote image viewing via teleradiology. Now the digital storage has formatted images which permit retrieval, transfer and display of X-ray images with large possibility of image related processing and different and manipulations. Okay. So digital X-ray imaging system comprise of these two parts, as it is given as transducer for X-ray imaging or data collection, and another is the data storage, processing and display. The transducer for X-ray imaging are of two types. One is the image intensifier TV system, another is the radiography, that is film replacement system. Okay. So here the X-ray imaging that has its use in angiography. Now, what is that? Angiography, that is a diagnostic and therapeutic modality concerned with disease of the circulatory system, and the procedure involves using contrast material to opacify the vascular structures, and this is because the radiographic contrast of blood is basically the same as that of the soft tissue. So iodine compound is used as contrast material, which is injected through a catheter of diameter of few millimeter, very small, and radiographic images of the contrast filled vessels can be viewed on a TV screen, or it is recorded using either film or either video. Next, here the digital subtraction angiography, or short it is called SDSA. That is the most important application, and what is happened in this case? Pre-injection uh, image that is awkward, and the injection of contrast agent is performed, and then images of the opacified vessels are awkward and subtracted from pre-injection image. Now this helps in contrast enhancement, which increases the contrast sensitivity. So on the left hand side diagram, this is the transmitted X-ray intensity through the cross section of a patient, and the small contrast changes due to vessels are missed by a large anatomical background contrast image, and it uh, so these small signals are attempted to be amplified, which gives to saturate uh, it gives to saturation of the display system by the large background signals, and the subtracted profile is with the uniform background two vessel image that is shown over here on the right hand side. Next is the radiation therapy, where we can use the linear accelerator machine. So a large number of basically cancer patients receive radiation therapy either as a primary or adjunctive treatment. Now, the easily X-ray devices were of limited use in treating many types of cancer, as the penetration of the radiation was inadequate to treat deep-celled tumors without damaging the healthy normal tissue that is overlaying the tumors. Now, now this now these X-ray machines used to be voltages in the range of few hundred kilovolts, like 400 or 500 kilovolts, and correspond to a single energy which is about a few hundred uh, 100 kilo electron volt. So some Betatron units were developed which provided electron energies up to few millivolt, few mega electron volt, and they had greater penetration through the thick body sections and were suited for treating the tumors of the trunk and pelvis. Cobalt machines that was developed, which was simple, compact, and reliable low energy radiation treatment device using a pellet or radioactive cobalt isotope as a source of radiation. Now this machine survived for 30 years, and they had the tremendous advantage of producing that uh, completely predictable, steady, reliable beam of relative high energy radiation, and it is easy to repair and maintain. Today, most of the radiotherapy treatments are carried out using conventional radiotherapy linear accelerations. Now, linear accelerator portion. What is the function of linear accelerator? So it accelerates the electrons to the required level of energy. In short, uh, complete machine is referred as accelerator. It is designed to deliver a mega voltage X-ray beam suitable for modern radiotherapy techniques, and it is comprised of gantry and stand, treatment couch, and control console. So it produces energy ranging from uh, 4 to 20 mega electron volt. Okay, and this type of accelerator is here. Okay, so it's one type of block diagram. So the range of technologies used in the linear accelerator systems is very wide. It requires high power electronics in the order of megawatts. The dose monitoring system has to measure the currents of the order of 10 to 12 amps. Microwave technology is used here. Safety interlocks must be there. Gantry and patient must be there. Support call high technology and precision must be there. Okay. Next, the CAT scan or CT scan. As you have heard about that, all of you have heard this. That is the computerized axial tomography, or it is called the computed tomography scanning. So which combines the X-ray imaging with computer technique. So CAT, the computerized axial tomography, which permits the visualization of internal organs with greater clarity. Okay, the X-ray photograph, that is a shadow of all organs and structures in the path of the rays. So whenever two radio opaque objects are lying one behind the another in the X-ray path, the smaller of the two may be completely hidden by the larger. Okay, so here you can see this picture. So if the X-ray source and film are simultaneously moved in opposite direction, okay, in the lower diagram you can see it. So for a given combination of source and the on the film velocities, objects will appear to retain uh, uh, stationary with respect to the film during the movement of one single plane perpendicular to the path of the rays. Now the shadows of the object at all other distances from the source will move on the film and produce a blur. Okay, thus here the sphere lies here the sphere uh, lies in the plane that appears stationary, but cube does not. Okay, the shadow of the sphere that is hence reinforced as the X-ray vantage point is changed, and this vantage point for axial tomography are taken around the axis of the body. So a very narrow pencil-like X-ray beam scans a single slice perpendicular to the body, that is axis. Okay, now by scanning two or more slices, a three-dimensional representation can be created, and the measurement is done by means of one or more sodium, iodine, and calcium chloride crystal detectors by scintillating in proportion to the intensity, and the light is measured by photomultiplier tube. So X-ray source and the film move simultaneously in opposite direction. So one plane appears stationary on film and small sphere lies on the same plane. But present day, as you can see on the right hand side, so present day CT scanners uses X-ray sources which provide fan beams and multiple detectors to simultaneously measure the density across wide position of the slice. So it shows the fastest instrument having a fan beam that covers the complete width of the slice, and 700 detectors are used to measure the density pattern of the slice with good resolution. Okay, so high scanning rates are feasible, which permit the scanning of all sections of the body, and the patient is made to hold the breath and lie completely still for few seconds in order to complete the scanning. Now, synchronizing scans with the ECG helps to reconstruct the slices of the heart in various phases of the cardiac cycles. Okay, so this CT scan can provide the information about internal organs and body structures which could not be done by the conventional X-ray photographs. Okay, it is regarded as one of the major developments in medical instrumentation. So next, that is the CT scanner block diagram on the left hand side, and on the right hand side it is the electron beam CT scanner. So the X-ray source and the detector are mounted opposite to each other, as you can see in the in this picture. So if the patient is placed between the source and detector, X-rays from the source are passed to this body, and the radiation transmitted from the body is then sensed by the detector, and the source of moving or detector or both across the section of the body. Okay. So the measurement are made at regular intervals, so that here in this way the electron beam CT scanner is used to measure the CT scan. Move on to the next slide, which is related to the MRI, means the magnetic resonance imaging technique, which is based on the nuclear properties of the hydrogen atoms in the body. So elements having odd number of protons in the nucleus have magnetic properties. Such elements are like hydrogen 1, carbon 13, oxygen 17, sodium 23, fluorine 19, etc. So hydrogen atom nucleus that has a single proton, which being odd number, has the property of spin, as it is given here. So this works like a magnet. When the patient is placed in a strong magnetic field, the magnetic movement of uh, proton align with the or against the field lines of the magnet, as you can see in the right hand side picture. So small excess of magnetic moments of protons align with the field, so that the net magnetic vector is created. Now if a radio frequency pulse of the same frequency as the um, processing nuclei are applied at right angles to the main static magnetic field, the hydrogen nuclei uh, tissues get disturbed, and they absorb energy and change their orientation with respect to the magnetic field, and after that they are lifted to the higher energy state. Now if the field is put off, the hydrogen nuclei go back to their low energy state after emitting energy they had received. So all this process is known as nuclear magnetic resonance. Okay, and here the emitted energy that can be detected, that can be digitized, amplified, or it is encoded and transformed by computer into uh, cross sectional um, images. Okay, so the MRI images are very accurate for visualization of tumors, inflammatory and vascular abnormalities. Now MRI scan, it is a radiology technique combining magnetism, radio waves and computer to produce image of organs. So the MRI scan, one diagram, schematic diagram is given here. So the patient that is in a magnetic field created by a magnet, and the RF transmitter or receiver, uh, it transmitter sends the waves to the patient, and RF receiver receives the uh, it detects the signal. Now the intensity of these signals are converted into an image. Okay, so there are several MRI techniques are available, like ECG, gated spin echo technique, which provides the static image with high signal to noise ratio for evaluating the anatomy problem. Another is the ECG referenced gradient echo system is available, that is used for displaying the dissection within aorta, if any extent version of the dissection is possible or not, that can be uh, detected. So now cine gradient echo, that is used for accessing the cardiac contractile function. Cine MRI gives the tomograms of the heartbeats in a different format, and the velocity encoded MRI is there to estimate the heartbeat gradient across valvular stenosis and the different flows of in the heart. So a MRI basically, it is a non-invasive technique with excellent soft tissue contrast. So MRI, it's a slow process, relatively expensive process, but it cannot image bones. Okay, MRI is used for only soft tissues, brain, vessels of brain, eyes, inner ear, heart, abdominal vessels, kidney, etc. and naturally it is able to diagnose related problems of these organs. Okay, so that's all for today, and that is the topic based on, these are the topics based on the imaging technique, different imaging techniques. Okay. Okay, up to this topic, that is module number 2, um, module number 3, 4 and 5, that will be the syllabus for CA3, and there will be a quiz. I think the quiz will be uploaded on Friday night or Saturday, and I will give you 24 hours to complete the quiz for CA3. The quiz will be related to the module number 2, 3, sorry, 3, 4, 5, I think, up to this one. Okay, up to imaging techniques. So all of you must check the Google Classroom, and after 24 hours, no quiz will be accepted. The answer of that quiz will not be accepted anymore. So I will give you 24 hours to complete them. So either it will be uploaded um, Friday night or Saturday. Okay. So I will inform you through Seer, and all of you must participate on that quiz. Okay, that will be evaluated for
স্যার আপনি এখনো দেননি তো?
না না দিইনি, আমি ফ্রাইডে নাইট বা স্যাটারডে দেব, 24
আচ্ছা,
আওয়ার টাইম দেব। বাকিদের বলে দিও
ঠিক
যারা
আছে।
কয়েকজন হয়তো মিস করেছিল গতবার, বাট 24
হুম,
আওয়ার্সের পরে কিন্তু আমি কোনো কুইজ অ্যাকসেপ্ট করব না,
ঠিক আছে স্যার।
কোনো এক্সট্রা টাইমও দেওয়া হবে না। যদি বলো যে আবার কেউ টু ওপেন দ্যাট কুইজ এগেন, নো। হুম, সেজন্য একটু বাকিরা সবাই খেয়াল রেখো। I will information to your seer, and all of you must contact with seer. Okay, and he or she will share that information, obviously, to all of you. Okay. Okay, so is there any question? Is there any question? Okay, if you don't have any question, so I'm ending this meeting. Thank you all. Thank you.